How you doing? Like I said, match week just went by recently. The nervousness, the excitement, the relief, the joy when everyone's match emails came through was contagious. But with it came a lot of questions about USMLE, and we're here to answer that today. We have with us a guest who I don't really have to introduce, the go-to YouTube channel for anything to do with USMLE, Manik. So I'm going to add him on, and let's begin with our session. Let me invite Manik. We're so excited to have Manik Madan with us. It's a huge deal to have him here, and he's just matched. Let's hear what he has to say. Let's get all your USMLE questions answered. Feel free to put them into the comment section here. We've already got some questions before. Hi, Manik. How are you doing?
Hi. Yeah, I'm doing really well. Like the day is going great. Yeah.
Awesome. So normally what I do is I introduce the person. Today I'm going to
Yeah.
try something new because with us, we're not all that great at interviews. We're not all that great at knowing how to present ourselves. So Manik, I'm going to ask you to introduce yourself as you would to an interview panel. Who is Manik Madan? Floor is open to you.
So thank you so much, by the way. Hi, my name is Manik Madan. I am an Indian IMG, born and raised in India, specifically the northern part, like in Ludhiana, Punjab. I did my medical schooling from KIMS Bangalore, which is in the southern part of India. So I love the southern part of India, and I gained my love and respect for psychiatry in my medical school. For the past year, I've been doing a series of externships, as well as I've worked as a remote research assistant, and then I've gone throughout the whole match process to get myself a residency spot in America, specifically in psychiatry. I come from a family of physicians. Both my parents are doctors, and that's where I gained my love for medicine. And I gained my love for psychology when I was in my high school, and I read this book called Brain Lock, which was all about solving OCD through self-CBT. And I'm just really into psychology a lot. So I was like, how do I combine my love for medicine and psychology? And I think my answer to that was psychiatry. And I think, my medical school just solidified that for me and made me want to go into that more. So by the way, I'm just very thankful to be here with you and just discuss all about USMLE with everyone who's very interested in it. Because let's have a great session. Right. So.
Thank you, Manik, for agreeing to come here. I know you're really busy with preparing to get your residency started. So we're really excited to have you here. Let's dive right into it.
Yeah.
So the first question, obviously, is can you take us through the whole process of USMLE? Right from the beginning to the end.
Okay, so the USMLE is a two-part process. The first part is about the exams, right? Step 1 and Step 2 CK. The second part of the process is more about the qualitative aspect where you do your rotations. You go to America, you do your rotations, you write your personal statement, you build your CVs, and you get your LORs, and then you apply for this thing called the match, like go throughout your interviews, and then you match. So like it's a two-part process. So starting from like the first part, which is more of a quantitative aspect, which is the steps, right? So there's Step 1 and Step 2 CK. Step 1 is a preclinical exam, but to be honest, it's not totally preclinical, because what do you get when you combine physiology, biochemistry, pharmacology? You get medicine, right? So exactly. Step 1, yes, it's termed as a preclinical exam, but it's not totally a preclinical exam because they combine various aspects and give you clinical cases. So yep, so that's Step 1. And the second thing is it's going pass-fail. So everybody's very curious about that, right? Step 1 used to be one of the most important determinators of like whether you will get an interview or not. But since it's going pass-fail, that like determinator would become Step 2 CK, which is much more clinically oriented and tests your like clinical knowledge, let's say, and goes one step beyond Step 1 really. So that's Step 2 for you. So once you're done with your Step 1 and Step 2, there's another exam that you need to do. It's called the OET. So previously we had Step 2 CS, right? But because of COVID and other issues, they canceled Step 2 CS. And now we have this exam called the Occupational English Test, which tests your interpersonal and communication skills related to medicine specifically. right? So once you're done with all three of these exams, you get this thing called as ECFMG certification,
Right.
which means that you are at par with an American grad. Like, they can compare you to those people, and you can participate in this thing called the match, right? So the match basically is this event where, like, you as an interviewer participate, right? As an interview, sorry. And then you have medical programs all over the US who participate. So you send out applications. So let's say you have your step scores, you have your LORs, you have your CV that you've built, you have your personal statement, and you package that in an application and you send it out to all the programs that you apply for. If they like your application, they're going to send you an interview, right? And you're going to
Right.
get interviews, right? By the end of the math season, you're going to rank the programs you like from, like, number one to the last program. They're going to do the same thing for the people that they have, interviewed. So they're going to rank you and other people from, let's say, the topmost applicant that they want to the bottommost applicant that they want. And according to the number of spots that they have, like that, like, and there's this algorithm called the NRMP algorithm. It's
Right.
decided whether you match or not.
Okay.
Yeah. Yeah.
Okay, awesome. So that I think covers the whole thing. And guys, before we go any further, Manik has a video about literally any question that you might have on his YouTube channel. So for more
Yeah.
details about anything, head
Yeah.
there because that's where you'll find every little detail. So let's go into each of these steps that you said. Step one, step two, the electives. Let's dive into the questions that we have about each of them. So talking about step one, what are the resources and the preparation strategy that you would use for step one?
So the main resources for, first of all, like step one's going pass fail. So that
Yeah.
does change how you prepare for step one. It's not going to be as serious as it used to be. However, like, the thing is, about 60% of step two CK is step one, right? And step two CK builds upon step one knowledge. So we need to be like, we need to take that into account too, right? So
Right.
the way to deal with step one right now is, first, people used to take about 6 to 7 months for step one prep. So I would take out 1 to 2 months out of that step one prep and give it to step two CK, because step one is going to go pass fail and step two CK is going to be scored. So you should focus more on step two CK. But again, do not ignore step one, right? That's
Right.
important too for building basics. Right, so prepare for step one as if it was scored, but again, give a bit of that time, like let's say 10 to 20% of your step one prep time to step two CK, and do it faster, right? So the resources that you need for step one really are WOOF apps, like that's the mnemonic we use, and it's really Boards and Beyond, which is the video series for step one, and it goes hand in hand with the book that everybody knows about, First Aid, right? So you
Right.
just open Boards and Beyond and just start annotating on First Aid any points that First Aid doesn't mention, and just, like, underlining any points you might have. So Boards and Beyond and First Aid, like, they go hand in hand. So you should prepare with that. After that, what I would recommend is, like, either simultaneously or after that, you can do a question bank called as USMLE RX, right?
Oh,
So USMLE RX is a Q bank by the First Aid team, like, you know, the people who have made First Aid, and it again
right.
goes hand in hand with First Aid. So let's say you get something wrong in USMLE RX, the question bank. You can, like, look at the question and they're going to give you an explanation according to the First Aid page. You can go back to that page because it will be written which page that question was made up from, and you can write or annotate anything, like, you missed, and you can read that thing again. So read that concept again, which is really good, right? Because
Right.
now
That
you're
gives
going
you
to see,
feedback.
yeah, you're going to see concepts in a question based manner. You're going to be like, okay, this is how this can be tested. So let's say I'm going to think about DVT. Okay, now, like, there's a very big difference between just reading about DVT. Okay, so DVT is thrombosis of the distal veins, popliteal veins to be more specific. That's one thing. Okay, and reading about the risk factors. Okay, it happens in females. Estrogen is a big risk factor. OCPs are a big risk factor. But there's a very big difference in reading a question about it where they tell you nothing about, okay, whether it's DVT or not. They want to give you like a
Yeah.
case about a female who was like traveling on an airplane, and suddenly, like, one of the legs got swollen up, and she has pain there. There's a little bit of fever. Okay, and like, you could be like, that could be cellulitis. Maybe that could be DVT. So there's just so many differential diagnoses that are going to run in your head. And that's very important to happen with question banks like USMLE RX, because you need to know, okay, if I'm reading about DVT, what other condition is very similar to DVT? Cellulitis, right? Maybe lymphedema. So these things should be very cleared up, because in every question, like you're going to get about DVT, the DD that they're going to give you in the answer choices is going to
Options.
have
Yeah.
like cellulitis in it, right? Or lymphedema in it. So that's very useful. And I think you should do USMLE RX. It's a great question bank. After you're done USMLE RX, you've learned about differential diagnosis and how questions are going to, like, how concepts are going to present in a question-based manner. Shift to UWorld, which is like one of the main question banks for the steps. So especially for the step one. So do UWorld. And I think another resource that I would recommend would be Sketchy, which is picture mnemonics. I don't know if you've tried that. Like, they're really useful, especially for Palm and Micro. And I think like without them, I wouldn't have scored so high. So that's about, yeah, Pathoma is another resource that you shouldn't miss. It's for pathology. And like that's BOOFAP. So Bows and Beyond, UWorld, First Aid, Pathoma, and the last one is Sketchy. And yeah, that's about all of it. USMLE RX is again a First Aid part. So that's why it's not in that mnemonic. Yeah. So.
Right. So that's awesome. And you've listed out everything that we need to do and how to use it, which is something I think most people wanted to know, and most people lack the exact strategy of how to do it. So that's pretty amazing. The next question people want to know is, how do you balance your college life, your college studying for exams and things like that, along with the USMLE studying for the steps, along with the extracurriculars that you need to build? How do you juggle them all together?
So that's a really good question, and that is like something that I struggle with even right now. Like the first thing I would ask you to do is like learn how to learn. I know like, and the thing is like, there's this concept called meta learning, which is all about learning how to learn. And the problem is most people don't know how to learn properly, and they use inefficient techniques to learn. They have slow reading, which hinders their learning. So there are a lot of courses online that you can go and watch. Like there's this course by Jim Quick, who is like, who has this course called Super Learning on Mind Valley. If you want to learn how to learn very quickly, I have a course which is free. It's called High Intensity Learning, which is about meta learning. And let me give you an example about like how meta learning works. For example, like, you want to learn the meaning of adulation, right? Adulation. So I could just tell you that adulation means admired, and you're going to forget that after about 1 year, right? Another way to learn that is, I'm going to tell you, okay, adulation, let's split the word and think about it as like this. Adolf Hitler's nation admired him. So what we just did was we took like phonetically similar words. So adulation, Adolf Hitler, his nation, adulation, his nation admired him. So now we can imagine stuff, right? So the thing is, human memory is mainly photogenic. If you think about it, our ancestors, they did not remember, like, like thousands of years back, they did not remember words. We have not been evolved to remember words. What we have evolved to is learn pictures, like images. So learn how to convert those words into images and then how to learn them. So that's just a very basic technique. It's about converting words to pictures and then remembering them like that. So that's just a very basic technique. You can use that with numbers. That would be my first tip to you, is just learn how to learn, because that's going to decrease your number of repetitions that you're going to take to remember like a specific piece of content. Secondly, like try out Anki. Anki is pretty helpful, like whenever you have free time. I don't know if you guys know about Anki. It's a space repetition software which has an algorithm which helps you learn stuff. So you can just Google Anki, how to learn medical concepts with Anki. I think that's very helpful. Thirdly, with time management, I think it's a skill that comes, when you try. If you're not trying, it's not going to come. Stop wasting time in doing things that are not productive. For example, gossiping, stuff that doesn't really help you, and instead devote that time to, building certain aspects of your CV, like public speaking. And I think that would be a better aspect. Like you have to want to do it from your end, rather than just wasting it on movies, sometimes like wasting it on binge watching TV shows. that are not really going to help you. Like, I'm so sorry if I'm like offending a few people, but like sometimes a few TV shows really don't help you. You can just miss out on a few series and rather dedicate it to your studying, I guess.
I think that's a hard truth we all need to hear.
Yeah, like so that like without sacrifice you can't gain anything very like big things. You can't like go do big things without sacrificing a lot of things that you don't really need. Yeah.
That's right. So your learn to learn, I think, is the most brilliant point that we've all heard today. And I think everyone should definitely spend a little more time learning how to learn before we actually dive into it and try and mug up the books because, yeah, what you said makes absolute sense.
Yeah, and the thing is, like, a lot of people think that they're too clever. Like, I used to be the one, like, who was like, this advice is full bullshit. Like, this doesn't work. He's just like, trying to, like, show us his course and everything. It's not like that. Trust me, like, I heard this really good quote, and it says, like, sell your cleverness for some bewilderment. Sell your cleverness for some bewilderness and you'll be surprised. So be a kid and like learn like kids, because kids are the fastest learners, because they are the most innocent people, right? And so they can open themselves up to more models of realities, more truths that we would like otherwise just reject as adults. We'd be like, okay, that
That's
doesn't work. That's a very problematic attitude. A lot of people have. I used to have that.
I can completely relate to that, and I think that's something I need to work on too. So, okay. So the next question we have is about step two. What resources would you recommend for that? And does this
So
strategy
for step 2
change or
CK,
would it be similar?
so yeah, because like step one's going pass fail, step two is gonna take the front seat right now. And like, see, the thing is, PDs need numerical data to sort through applicants. When you're getting 10,000 applicants in one program, how are you gonna like select a few applicants to interview, right? Like, they're just human. So, and I've had this discussion with like a lot of PDs, and a lot of them will be shifting to step 2 CK. So you need to be really, really thorough with your step 2 CK prep. Like I previously said, the number one tool that will help you with step 2 CK prep will be step 1 prep, because everything in like the steps builds up like on a staircase. Like, so let's say step 1 is the first step, then is step 2 CK, and then like step 3, right? So step 2 is gonna require step 1 knowledge. Without that, it's very hard to score really high on step 2 CK. So remember, a good step 1 foundation is the number one thing you need. Secondly, what I would say is, rather than wasting your time on watching video series, do UWorld, and I think that's more than enough. Like, right now, it's like about how many questions? 4,000 plus questions. And each question is very long. Trust me, like step 2 CK questions are very long. The stems are very long. The explanations are very long. So it's going to take you a lot of time. Like, right? So I would, rather than wasting it on like books that are not going to help you, rather than wasting your time on video series that are not going to help you, I would just give it to the highest yield resource, which is UWorld, right? That's most of all you need for step 2 CK prep. Uh, if you do want to use a book, there's this thing called the Amboss library. Amboss is another question bank, and they have this thing called the Amboss library, where, let's say you're confused about this thing called STEMI, which is ST elevation myocardial infarction. You can just like go to the search bar, search it up, and they have everything you need for step 2 CK prep, right, in high yield. So like that's what I used. So if I was confused about what like the difference between cauda equina and conus medullaris syndrome, I would just go there, type it out, and they would just give me a table which would differentiate both of them, and it was really helpful, right? If you want to just like score even higher, do the Amboss question bank after your UWorld prep, like you've done UWorld. So just to test out like how well you know your UWorld concepts, go to Amboss and do Amboss. That's about it. There's another thing called the CMS forms, like that should be used in the end phase of your preparation, which is from the NBME, and they are specific for each subject like medicine, psychiatry, and they're going to give you like an insight into NBME's thinking and how they think, because it can be a tad bit different from how UWorld and other question banks think. So have a look at CMS forms and do your practice test like the NBMEs, and I think you should be good to go for step 2.
Excellent. That's amazing. So now that we've got step one and step two, is step three important to give before you submit your application, or is it okay to give later? If so, when is the best time to give it?
So again, a great question. Like with step one going pass fail, what's gonna happen is like a few things, right? See, step two CK again is gonna take the front seat. That's for sure. Secondly, what's gonna happen is step three is gonna become important because every program is gonna be like, okay, if you don't have a step one score, okay, what else do you have now, right? So like people are going to look at step three scores, and there are reasons for this. First of all, like first reason, if you're done with step three, your program doesn't have to give you time to prepare for step three, right?
Right.
Let me first put context. I'm so sorry I did not put context here. So step three usually is given in the first year of your residency training by American grads and a lot of IMGs too. But it can be given before, like joining residencies, by IMGs. So, and it's not necessary for you to match really. But since step one is going pass fail, step three is going to become important again for two reasons. Number one, programs don't have to give you extra time to prepare for it. Secondly, they don't have to worry about you failing it, because if you fail step three and you're not able to clear it until the end of your PGY1, PGY2, you're going to get kicked out of the program, like because like you just can't practice there. So that's something to know about. So if you're already giving them the guarantee that you've already done with your step three prep and you're done with step three, like what better to have, like if
Right.
applicant A and applicant B are similar on paper and one has step three, I'm going to choose the person with step three, right?
Right.
One more thing, like the school you come from is going to become important. For example, if you're from Ames, if you're from government schools, if you're from like let's say Lady Harding or MAMC, right? What happens in the US is, like, I found it very surprising. So let's say you're in a big program, you're gonna see people from Ames, Delhi, MAMC be there, and the PDs are very like familiar with all these people, all these schools. Okay, I've heard about LHMC, I've heard about MAMC, right? So when you don't have step one scores, that can have like more importance, the school that you come from, because if PDs see, okay, smart, like, they see smart people coming from Ames, Delhi, they're going to be like, Ames, Delhi is a good school. That's where I
Right.
want my like future residents from. So that can be like something you should consider thinking about. The last thing is visa status. If you are a green card holder, like, congratulations, it's just gonna get easier for you, because the programs are not like, they don't have to worry about sponsoring a visa for you. So if you're a green card holder, again, like with step one going pass fail, that's gonna become more important.
Right. So anything that makes their life easier, of course, is something that they would prefer.
Yeah, they're like just humans, right? At the end of the,
Right.
like, just think about it. At the end of the day, they have a family and they have their own life. They just want to get done with work and they want to have the least amount of stress possible, right?
Absolutely. Yeah,
So like if you were in their place, you would do the same thing.
that makes sense. Of course it does. Yeah. All right. So we move on now to the electives. Now,
Yeah.
how do you choose an elective?
So first of all, like in my medical school, I would like think about which specialty I want to go in, right?
Okay.
Because like if you're going for an elective, what you're thinking about is you're gonna get get one LOR out of that, right? At least one. So, and that LOR should be, let's say you're going to apply for the match in the future. That LOR should be for that specific specialty. Otherwise, it's useless, right? Because let's say I want to apply for psychiatry and I have one LOR with me for internal medicine. That's gonna work against me, because the
Right.
psychiatry person would be like, am I your backup? You like IM, and why are you applying? So just be like, first point, ask yourself which specialty do I want to target in the future, right? For me, that's psychiatry. So I was always about like, okay, how can I get a psychiatry USCE? Because if you don't know like which specialty you want to go in, you can't always get to that institute, right? Because different institutes sometimes have different specialties they give electives out for. So that's
Right.
important, right? Number one. Number two, join this network called VSLO. So what happens is there's this network called VSLO, which allows foreign medical schools to communicate with places like Mayo Clinic, Mount Sinai, Cleveland Clinic, and allows medical students from foreign medical schools to rotate in these US medical schools. So VSLO is paid. So you need to pay about $800 per year to be on the VSLO network. And the way you can join it is I can share it like a post with you, and you can just share it on your page, and it'd
That
be
would be
really
great.
helpful. You can just get people from your medical school, like who want to do USMLE, like your co-students, and ask them, like, we can join the VSLO network, and you can pay the fee together and just join it. And that will give you access to like big places like Mayo Clinic, Cleveland Clinic, and Mount Sinai. And I think you should try to do rotations here. If you have graduated, the story is very different. You have just two options with you. One is observerships. The second is externships. Observerships is hands-off, meaning you are not allowed to contact the patient. You can't talk to the patient, no physical contact with the patient, right? And externships are hands-on, which means you can touch the patient, you can do physical examination, you can talk to the patient. Now, like, why do an externship over an observership? Well, like, the reason you need to, like, and the reason that's important is because if I am the LOR writer, what gives me more to write about, an externship or an observership,
An
right?
externship. Yeah.
Yeah, in an externship I can write, okay, this guy knows how to do a physical examination, he has good like clinical manner, he has good like patient knowledge, he knew how to talk to the patient, he knew how to like ask the right questions, right? But in an observership, you're just shadowing the physician, you're not talking to the patient. What is that physician going to write about you in an observership, right?
Right.
So that's something to consider. However, if you're getting an observership in an institution that has, let's say, a residency in it, that's not a bad idea either, because if you make good contacts in that institution, right, the LOR might be like mediocre at best, but if you know people there, they might take you. So that's not a bad idea always. But an
Right.
externship over an observership generally.
So, Manik, what's the difference between someone who hasn't graduated going for an elective versus someone who's graduated going for an externship? They're both hands-on, right? So, what is the difference between those two?
Yeah, so it's just graduation. Like generally, like an elective is considered superior to an externship, right? Because you're still like an undergraduate. So it's just like considered superior. But if you don't, like if you have graduated, you have no other option. An externship is like a tad, lower in its value, but it's fine.
Okay.
That's it. It's all about graduation. That's it. Not much,
Okay.
but like generally electives are a tad bit superior to externships.
All right. Got it. So, how many electives should a person do? And also, a second part to that question is, what should be the breakup between clinical research, I mean, a clinical elective and a research elective?
So first question, how many electives should one person do, right? How many rotations should one person do? So my recommendation would be like, so what happens is when you are making your ERA CV and you're applying, you get uh, a chance to upload 4 LORs, right? So let's say like, and the thing is one elective can generate multiple LORs. So in one of my electives at Jackson Park, I got 2 LORs from the same rotation, right?
Wow.
So yeah, so it varies. So like at an average, at least you should do 2 rotations, like, and if it's possible, do 4 rotations. I think, there's no, like, there's never, how do I put it? There's never, like, you can never do too many rotations. So as many as rotations you can do, and as many as rotations your finances allow, the better, is how I
Right.
would put it. Right? So, but at a minimum two, because like, and the thing is like, there's no general rule to this. There are people who match without electives, but then they have good scores. They sometimes know people. They are US citizens a lot of the times. Like you can't always tell that, because they don't always tell you that. But yeah, so there are people who match without electives, and then there are people who match with electives. So let's say you are a visa seeking candidate and you need a visa, most probably you're going to need electives. So at least 2 electives, like that's like for sure I would do. And telerotations, please don't, I wouldn't advise for telerotations, because so many institutes don't consider them as rotations, and you pay a lot for them. Like companies charge $1,000 for a telerotation for a month, and you don't get any hands-on exposure, so I wouldn't recommend them. So like, please go to the US, do hands-on rotations, at least two. And there's like, you can never do too many rotations. So remember that rule. So if you can get any experience and you have free time, just go and do it. It's always good to have more
Right.
rotations in your hands. Yeah.
So, Manik, with
The second,
COVID, right, sorry.
yeah, the second question, right? Like about research electives versus electives. I'm so sorry that I had to interrupt you. Like, I just want to answer this
No, no,
question.
please go ahead. Yeah.
Okay, okay. So like, yeah, generally speaking, a research elective is like needed for more competitive specialties like dermatology, like OBGYN, then orthopedic surgery, neurosurgery. So if you want to go into competitive specialties, good scores are not gonna make the cut. Like getting all the LORs are not gonna make the cut because everybody has that. Right? If you're gonna go to really competitive specialties, you're gonna need research electives and at least a minimum of 1 year. And the reason is because like if you do shorter research electives, you're not going to make strong contacts. Secondly, you're not going to publish any papers because a good paper takes time, right? It takes a lot of time, and it takes time to learn research properly, and most IMGs don't know research. Like we don't know much about research, and it takes time to learn about it. So I would say at least 1 year of research elective, otherwise it's a waste of time. And the other reason you might need a research elective is, let's say you're applying for an IMG friendly specialty such as internal medicine, pathology, family medicine, is if you have low scores, let's say you don't have good scores, and you're applying to a specialty where people have higher scores than you in, like, as an IMG. So they're having research on your CV and having contacts in your favor, it's going to help you a lot. So and research electives, a lot of people do them when they don't have good scores, or let's say they don't match, so that they can increase the chances of them matching the next year or the subsequent years, right? So
Right.
yeah, that's about it.
Right. So basically, a short research elective or a research elective of the same duration as a clinical elective isn't as effective. You should rather do a year-long research elective to get something out of it, get value out of it.
Yeah, you can do like a clinical elective for 1 month. That's fine, right? You don't need to do it for like 1 year. That's just too
Right.
much, right? So yeah, that's about it.
Okay, awesome. So, Manik, you were talking about telerotations earlier. So now, because of the whole COVID lockdown situation, there are a lot of students who were interns and had to complete their internship, couldn't complete an elective, and because of the whole COVID duration, they couldn't get a visa to go to US and actually do a physical rotation over there. Would you say it's better that they do a telerotation just as something, or wait until they can do an externship and then apply?
So here's my opinion on it. Like, there's no right answer to this. So just like, take everything with a grain of salt. What I would say is like, I have had like too many friends, like, and they've talked to so many PDs, and the PDs have blatantly said this on their face. We don't consider telerotations as USCE. So like, and the problem is companies are charging way too much, like thousands of dollars, and they're going to go to waste, right? Because if like
Right.
the best institutions or the good institutions are not going to consider them as like USCE, why even do them, right? And
Right.
so that's an issue, right? Like, I would rather do the externship if it were me. Like that's how I would put it. I would wait. I would do externships, go to the US, like, and then apply because I want to match into a good program. Trust me, there's nothing worse than matching into a bad program. Like, right? Because just think about it. You want to match with somebody who's actually like, think about dating, right? You want to date somebody who you really like. You just don't want to like, and you want to marry somebody who you really like. You don't
Right.
want to go with somebody you like. In the end, you're like, okay, it just works, right?
Right.
Just think about it. Yeah, right.
Exactly.
So that's my like philosophy on this is don't sell yourself short. Go with places like that you feel that you deserve, and even if it takes time, it's fine, right? People do research electives for 1 year, 2 years. Why? Right? Because they want to go to places they really like want to match with,
Right.
right? So that's what I would say is I would wait. But again, that's me, right? If you want to do the telerotation and you think it will help, go ahead and do it, right? And apply if your finances allow it. So like, yeah, that's how I would put it. If your finances allow it and you don't think it's gonna make or break your bank account, and you wouldn't worry about the money, just go and do it and apply for the match and see what happens, right? But be aware that the best institutions really are not gonna consider those as like, and you might not get an interview from the good institutions that you want to go to, right? And you can apply and you might match. So that's, or just wait. If your
Right.
finances don't allow and you want to go to good places, just wait and do the good rotations, right? So that's how I would put it. Yeah,
Right.
it's a complex question to answer. Like, see, there's no, like, it's just such a personable thing, because so many people are okay with okay-ish institutions and they're like, okay, I just want to match, I just want to be a practicing physician, right? But
Right.
it's 3 years, so it's
Yeah,
very
right.
personable.
That's true. That's true. It's 3 years and you got to figure out, and you're going to be there every day for those 3 years. So you want to do what fits best for you. So if telerotations isn't going to make it, then that's something to think about before you actually do it, before you sign up for it.
Yeah, yeah, like I would again think about doing research, learning about research and publishing papers rather than like doing telerotations. But that's just me, right? So just
Right.
remember that.
Right. Absolutely. Okay. So the next question is, should electives be selected depending on the branch one applies for? So some people don't exactly know exactly which branch they would want to apply for. So is it worth doing multiple different electives in different branches, or how should you go about that? Or how does one maybe streamline and figure out what branch they should go for?
So I think like in my medical school, I was exposed to about every single branch, and like I found my love for psychiatry pretty early. Like I knew I was like, this is my branch. But for a lot of people, that's a problem. But I think internship is a great place to explore that. Like, and really, like I would look out for, okay, what aspects, like pros of the branch, cons of the branch. Okay, what do I like about this? I would like not go into a certain branch for the money, because like, if you look at Maslow's hierarchy of needs, we all think we need money, but like money is a means goal. It's not an end goal, right?
Right,
The reason people want money is because money buys respect. So when you have money, you can buy a BMW, you can buy big houses, right? And that's going to earn you respect. But in truth, like you don't really need that money. What you need is respect. You need other things, right? And that's why big people, like if you look at CEOs, they leave like they leave their salaries for positions where they won't get paid just because they like that place. They want to work in that, right?
right,
So in the end, I would look out for, okay, what really ignites my curiosity, like what am I curious about? Where do I feel like I would work in this specialty even if I weren't getting paid? So let's say they're not paying me, but I still would work there. So I would ask that question, like where, like in which specialty would I work if I weren't getting any money for it? And that's like whenever my interviews, they ask me like, why psychiatry? That would be my answer is like, I ask myself like, if I weren't getting paid, which specialty would I do? And I think psychiatry would be that, because I'm just like, it ignites my curiosity and I feel like time stops, and the world stops existing and it's just me and the patient. And like, I'm just talking to the patient and we are having this conversation, which is so beautiful. And like, I think that would win a lot of hearts, like that whole conversation. So look for the specialty that you would do, even if you weren't getting paid for it, no money, right? That's your
right.
specialty. And yeah, I would look out for that in internship. The thing is, as you're competing with American grads, these people already know where they want to go, because they've already been through like their pre-med, like, and they're way
Right.
older than you and they know where they're going. So you're competing with people who were doing research for, let's say, neurosurgery in their pre-med,
Exactly.
right? And PDs, like they like that. PDs like people, let's say if I want to go to psychiatry, they like people who are sure about psychiatry right from the get-go. They don't
Right.
want people who run the dice, right? Nobody wants you to treat them as a backup, right?
Right.
So I would really, really, first of all, like look into, let's say I want to go into IM, like I would look for that in my medical school rotations, in my internship. and try to do rotation just in that, because it's going to show up in your CV also. So let's say you did a rotation in pathology and you're going to apply for IM. They're going to see that on your CV that you did a rotation for pathology, and they might think that you might be treating them as backup, or you are like dual applying. So you're applying in IM and pathology. So like that's a cause of concern for them, because they don't really want people who are not passionate about what they do. Like, and
Right.
in US, people take medicine very seriously. It's not like in India, like scores get you places. In the US, it doesn't work like that. If they ever feel that you're treating them as backup, you're out. Like, they're not going to rank you, because like, why would I want to work with somebody who doesn't like my specialty,
Right.
right?
They want you to know for sure that this is the one for you and you're going to stick by it no matter what.
So yeah, that would be my prime advice. However, if that doesn't happen with you and still stuck, go do rotation in the US. What you can do is, let's say you do a rotation in IM and then you do a rotation in psych. You can ask the IM preceptor to write like the LOR about psych, and he can talk
Okay.
about, okay, he rotated with me like in IM, but I saw like how passionate he was about psychiatry, right? And like that also happens. A preceptor in a certain specialty can write you and like the LOR for a different specialty, so that also works. So you don't have
Wow,
to
that's
worry
an
about
interesting
it.
approach.
Yeah, that happens. So you can ask, let's say, a person from a different specialty to write about how passionate you are for a different specialty. So you can do that. But again, my prime advice would be search for the specialty you're going to work for, like right from the get go. Like first year of med school, I know it's early, but American grads start way earlier, 4 years apparently before you. They know where they want to go, right? Because what happens is, let's say in America, you want to go to med school. Like for med school, they have an interview process. Like they go from pre-med to med school, and like
Right.
people, like, they have a defined trajectory before they are joining med school. Like, so I would say, like, look out for the specialty you want to go in from the get go. If you can't find it, do rotation in the US. Ask your preceptor, like, let's say you've done a different rotation, ask them to write the LOR for the specialty you're going to apply for. And I would say, like, a lot of people say you should have backups, but I think the reason I matched into my top choice was because I didn't have a backup. Like, and they
Right.
like it. They're like, this guy's
Right.
taking a risk and he's all in into psychiatry. And because of that, they are like, okay, we are going to choose him because he's just choosing us and nobody else. So, like, they like him.
Right. That makes absolute sense. Everyone likes to know that they're your first choice. So it's best to it's scary and risky also to keep all your eggs in one basket, but in a situation like this where they want to know that you are absolutely sure about what you want, it's also maybe more fruitful to do that.
Yeah, like definitely. Because the thing is, when you're passionate about the specialty you're working in, it's gonna be easier for them, because they're gonna be like,
Right.
okay, this guy doesn't think about this as work. He's enjoying this, right? And so
Right.
they can give you more work, and you're gonna enjoy, and you're gonna be a team player, and you're gonna like, once you graduate, you're gonna be like passionate about your specialty, and you're gonna like go into a good fellowship because of that, and that's
Yeah.
gonna like be good for their residency. So nobody wants somebody who just doesn't like the specialty and just is treating that as backup,
Right.
which is very
Makes sense.
contrary to the thinking in India. Very, very
It is.
contrary, where people treat psych as backup. Like if I don't get into this, I'll take path, or I'll take this, like pre-clinical subjects. It doesn't work like that in the US.
Right. Okay. So our next question, now we move on to the match application part of it. So what constitutes an amazing applicant through and through? Whether it's to do with the marks, the CV, the LORs, all over, what's the perfect package?
So, like this comes from my friend Alexandra Miragaya, who like just matched in psychiatry, and she's an IMG also. So we were talking about this thing called the tone of the application, and tone of the application means like how coherent your application is for that specialty. For example, if I'm interested in psychiatry, like, okay, so the first thing would be my personal statement. That's about psychiatry. Second thing would be my LORs. That's about psychiatry. Third thing would be my CV. So, for example, I've taken part in volunteer activities. What are those volunteer activities about? Are they about IM? Are they about psych? It's fine if they are about IM, a few of them, but they're going to see, okay, did this guy have interest in psychiatry based volunteer activities from the start, like mental health projects? they're also going to see like your research projects. Are they about like psychiatry, or are they about internal medicine, right? So like that also goes into your professional experiences, your hobbies. So for example, I'm very much into meditation. So I mentioned that I'm very much into self-improvement, which I feel is about psychology, like, and how like different mindset shifts can totally transform your life, like your paradigm, like the way you're living, and like going to a different level of a paradigm every single
Right.
month, learning something new. So they're going to see like how coherent your whole application is towards that specialty. And I think there's no certain perfect applicant. There's a perfect applicant for a certain psychiatry for that institution. And let me give an example. For example, look at me. Like, I'm very interested in teaching. I'm very interested in research, like, taking my specialty forward, like to the cutting edge. I'm very passionate
Right.
about academics, right? So I'm the perfect applicant for a university-based institution, right? But I'm not the perfect candidate for a community-based program, because they're going to be like, okay, we are not going to be able to like support his academics or his research endeavors, right? So like the perfect applicant depends upon, number one, the specialty, number two, the type of program you're applying
Right.
to, right? And
Okay,
it's all about
that's a great
coherence.
perspective. Mm-hmm.
And it's all about coherence. So it doesn't, like, yes, scores matter, yes, a lot of that matters, but in the end what everybody cares about is how coherent your application is. How, like, because in the US the direction you are going matters. They care, like, okay, were you, let's say if I want to go to psychiatry, they're going to see, okay, like, in his first year of medical school, was he doing any volunteer activity related to that psychiatry? Did he show any interest before joining medical school towards psychiatry? Something like that, right? And if you're sure from that start, like, they're going to be like really motivated to take you, and it's going to be enticing to work with you because you love that like specialty. So it's all about like the tone of your application, like how coherent that whole application is. Yes, scores matter, and they will matter, but again, tone of the application is far more important, because
Right.
that's what leads to a match. Anybody can score high, but not everybody can have that coherence.
Right. So the score acts kind of like a filter, screener, a first screening basis. But beyond that, they want to see that you've been consistent in your interest in that field that you've applied to.
Yeah, and how, like, and that too on a temporal line, if that makes any sense, right? Were you doing anything about that from the first year of medical school? Or were you like, okay, I want to do USMLE in the final year of medical school, and then you like, started? Like, so they're
Right.
very much looking into that. Like, I did not know about this. I hope I knew about this. So if you're in your first year of medical school, start thinking about that specialty, start thinking about doing activities in that certain specialty, right? How can you, and that will add up to the tone of the application.
Right. Yeah, I think a lot of us begin to think about USMLE or what we want to do next after MBBS quite late in the year, and then you're scrambling to figure out first of all what the process is, and then what you want to do and how to fix your CV and what activities to participate in. So I think we begin quite late. So anybody in the first year, start now.
Yeah, and if you're like from Ames, Delhi, and like MAMC, a lot of these students, I know somebody who's like who wants to go to neurosurgery, and right from first year she's publishing papers in neurosurgery. Like,
Wow.
that's how far they are. Like, and that's the reason they go to big places, is because these people are on it, like their whole application from the first year, right? And they know everything about it. Okay, I want to go to neurosurgery. From the first year, she's going to publish papers in neurosurgery. And what do you think will end up when she like applies for the match? People are going to see that. Like,
Yeah.
first year she's publishing papers. She's interested in neurosurgery. I want to work with her, right? That's like, and think about somebody who's like thinks about this after they've graduated. I'm not like trying to mock people. Like, I was one of the people who was like, okay, psychiatry, I want to do it, but I did not do many things related to that, like in my med school. So that was a bad thing, like on my part. But just think about it. As a PD, I would always want to work with somebody who was sure about my specialty, like from a long time ago, right?
Right. But in any case, what you did worked. You got your number one choice program. So I think whatever you did, it worked best for you.
Yeah, it did work best for me, but again, there are certain things I could have improved, which I'm gonna just tell you, and I hope people implement that. Like,
Right. All right. So we'll get to that in a minute. But the next question we have is, how do you select the right program for you in your final application, and how many programs should you apply for?
So, like as an IMG, what I would say is apply as broadly as possible. So let's say you can go to these websites called the Residency Explorer and the Frida. So these websites have like specialty specific data. So let's say I want to go into psychiatry, I'll type that and it'll give me, and let's say like only IM. So what happens is not all programs take IMGs and not all programs sponsor visas. So Residency Explorer and Frida help you like narrow down programs according to and sort them by like whether they take IMGs, whether they sponsor visas. So you can use them to see which programs you can apply to, number one. Number two, look at the IMG match rate. The programs with the highest IMG match rate should be the number one on your list, because as an IMG, your priority is to match too, right? You don't have the top, like you can't pick the top programs just like that because you're not like an American
Right. We
medical
don't have that
graduate, because
luxury.
we don't have that luxury, and it's fine, totally fine, because like
Yeah.
American medical graduates they have their own problems, bills to pay, debt, right? So that does make sense, it's fine.
Yeah.
So look at Frida and sort by the IMG match rate. Like Residency Explorer also has good data, and I would say like start from the top and go towards the bottom, and like apply as broadly as possible to as many as programs as possible, and according to your financial standing. So if your finances allow, apply. Like there's again, it's you can never apply to too many programs is all I'll say. Like I apply to broadly, I have to be honest, because and I remember you asked me a question. So if somebody applies, let's say, to 100 programs, how many interviews can they expect?
Right.
We don't know. Nobody can tell, right? It depends upon your scores, your LORs, your whole application. And let me give you an example. I have a friend like who worked really hard, who had all the LORs, did not get a single interview, applied to 200 programs, not even
Oh
a
my.
single interview, right? And then there are people like I have good scores. I got like 10 plus interviews, and I have a coherent application. But then there are people who don't have good scores, but they have networking on their side, right? Let's say you're from a good college like Lady Harding, and these people get 10 plus interviews, even with average scores. And you're like, how, right? And this is something you will also see when you go like towards the match. You'll have good scores, and some people who don't have good scores are getting far more interviews than you, like because they're from a good school, or maybe they
Right.
have a green card. So nobody can predict how many interviews you will get. It's all very variable based upon like your visa status, which school you come from, how many people do you know in the game, right? And what are your scores, like your USC, so many things, like so many variables. So nobody can tell, right? There's no
Right.
certain answer to that. So apply as broadly as possible, because like we wanna be just like, play on the safer side. So apply as broadly as possible according to your financial status, right? If your financial status allows it, don't restrict yourself, apply, right? That's what I would say.
Right. So it all depends on a lot of different factors, and also I think the only thing you can do is number one, apply to a lot of programs, and secondly, make your application as cushioned as possible. Do everything you possibly can to be a compelling application, and then you just got to wait and watch.
Yeah, like there's a line from the Invincibles, the luck favors the prepared. So that's it,
Right.
that's all you can do, right? So
Exactly.
prepare as much as possible, apply as much as possible, right? And like somebody's asking like Manipal, about Manipal. Yeah, Manipal has a big alumni, so you'll see Manipal people all over the US, right? If you're from Manipal, you can get into places because you have seniors all over. So like that's a good thing. I'm not
Right.
criticizing people, right? Like,
Right.
so I feel having that alumni network helps a lot. In the USMLE match, I did not know about this until I went to interviews, and I'll have some Manipal person like graduate in every interview, and be like, oh damn, like you'll see this, like people from LHMC, MAMC, yeah.
Wow.
So apply
Okay.
as broadly as possible, and don't worry. Give your best, and again, the number of interviews nobody can determine that. Just one extra interview might get you in, because you never know,
Yeah.
the one extra interview you get might be the one, like might be the one place that might take you in. So just apply as broadly
Right.
as possible.
Right. All right. So our next part comes down to the interviews now. So, can you can you just give us a brief overview of how an interview looks? How long is it? What is it that they want to know? I mean, I think in India, we're not so used to giving interviews. Most of our applications, our positions, they're filled up based on who we are on paper. So we've not really gotten used to presenting ourselves, how to present yourself. What is it that a panelist is looking for?
So that's a great question. So what happens is you have this whole application on paper, right? That you're great, and the program see that okay, this guy's got the brains to get in, right? So once that happens, they filter out the candidates and they give you the interview. What they want to see is, do you have the interpersonal and communication skills that is required to be a doctor in the United States? Because let's say you're good on paper, but you can't translate that performance on the paper in real life in front of them. What good are you, right? So
Right.
like, and even when they're ranking candidates, the number one aspect of ranking and like the most important factor is your interpersonal and communication skills. Your medical knowledge doesn't matter as much because if you like, if you were you're there in the first place because your medical knowledge was good enough, right? Number one. So
Right.
interpersonal and communication skills are what they're looking for. How do you talk to them? Do you know how to initiate a conversation? Do you know how to carry on a conversation? So let's say the conversation has an abrupt stop and you both are looking weirdly at each other. Do you know how to move that, right? How to take that like into another like topic? Do you know how to open
Right.
multiple branches of a topic, right? How to talk with that person? How, let's say like the interview is silent, how do you like, you know, how to talk to them about their hobbies, how to connect with them?
Hmm.
So these are very important skills that are important to them because they want doctors to be personable. Like they take that very seriously in the US and they want personable
Right.
people to become doctors. So I think that's the most important part. So how are interviews like? So, like first of all, like this time the interviews were virtual. So before, like I think 2 years back, the interviews used to be like in person. So you had to fly out to that certain part of the country and interview with them. But now they're all virtual. They're done through Zoom or Skype or like there's this Microsoft software that they use called there's WebEx by Cisco, and then there's
Right.
another Microsoft software they use. So they use different softwares and like so. Basically, what happens is first you go into the interview. There's an orientation where like the PD takes you through. Okay, what is like the advantages of coming to the program, the stipend, the benefits, like why us, right?
Mm-hmm.
What particular points like fellowship match rate, why you should take us, basically, right? After that, what happens is you are in this room where you meet other candidates, right? And you can talk to them, like, and it'll be like from I think 4 to 6 candidates. That's what happened with
Okay.
me, and we used to talk about like our experiences. And after that, you'll have individual interviews with like the faculty. And let's say I interview with the PD, another applicant will be interviewing with the associate program director, another applicant will be interviewing with an associate professor, right? And then
Okay.
we'll change back and forth. Like the next interview for me would be with the associate PD. So you move on. Every interview, like individual interview with a certain person, is going to last from, let's say, 30 minutes, 25 to 30 minutes to like about 1 hour. And that used to happen with me in psychiatry. And like in total, the biggest interview I had was 8 hours long.
Oh
That was my
my.
last interview. Yeah, 8 hours long. I remember that. Like they even had grand rounds. So yeah.
Wow.
So so you generally interview with 3 people: the PD, program director, the associate program director, and the last would be an associate professor or a resident, like of the program. And like again, what would happen is when you're interviewing with them, they have this checklist with them where they're gonna like, okay, did this applicant demonstrate this skill, like, and they're going to rank you and they're going to score you based on that. So everybody's
Right.
filling that out individually and the same day ranking happens for you, right? So
Oh,
that's
okay.
basically the interview. Yeah.
Okay. So it isn't a combined panel that interviews you. There are individual, say, 3 individual interviews that will happen for each program.
Yeah, like mostly. I have had an interview at a certain center where they had a panel interview. Like first I interviewed with the PD, and then I interviewed with the associate PD, and then I had a panel interview with the program coordinator, the residents, and a few other people. So I've had like one panel interview, but most of them are individual. You just talk to the associate PD like 101.
Okay. All right.
Or the PD 101. Yeah.
Okay, that's amazing. So, what generally do they want to know about you? Is it about you as a person, your interests, your experience? Is it about medical stuff? How does it go generally? Or it could go anywhere.
So so considering that they like, it's not going to be generally like medical stuff, but it's more going to be about like you on a personal level, because they want to get to know you, like the authentic you, like who you
Right.
are as a person. And that's about what matters. They're not going to test you on medical knowledge because they know you're smart enough. If you have
Right.
like, if you are like giving that interview, you're good enough, right?
Right.
The thing that they're looking for is we're going to work with this person for 3 to 4 years, right? For IM, it's going to be 3 years. For psych, 4 years. They're just going to be like, is this person not crazy? Is this person like all right in their communication? Will this person be a team player? Is he flexible? And like so there's this thing called behavioral questions that they've started asking, where they're going to try to test you on like how you're as a person, as like a team player, or how you're going to perform in a clinical case setting. For example, I'll give you an example. Okay, so I had a question where they asked me about, okay, what if a patient comes and you're the psychiatrist, and this patient is a pharmacy professor, pharmacology professor, and they ask you about like publishing a paper about psychopharmacology together, and he's your
Okay.
patient, and they're like, tell me what your response is gonna be, right? So my response was, okay, like I would like definitely tell my patient that, like, thank you for asking me that. And I would ask him like, why, like what makes him ask me that, and what's going on. I would try to get to the root cause. And in the like, so I went on with the answer, I'll try to be empathetic with the patient and blah blah blah. And then they were like, what would be your end response? Would you work with the patient to publish a paper? And my answer would be like mostly no, because it would be a conflict of interest. Since this patient is my patient, I can't, like, if I start being friends with him and publishing papers with him, I might not be able to communicate as a doctor. Like the patient physician relationship might not be as pure as it's
Right.
needed for me to give him information about his health, right? So they were like,
Right.
that's a great answer, right? So they're going to ask you certain, like, they're going to put you in certain scenarios. There's a patient who's depressed, and she just comes in front of you and she has panic disorder, and she's just in front of you. What is your next response? And
Mm-hmm.
like the answer would be, how can I help you? Like some open-ended question, right? So they're just going to put you in scenarios where they're going to ask you, okay, here's the scene, what's your response going to be, right? So they're going to ask you those questions, and they're going to test your thinking, critical thinking,
Right.
like how you think. Are you a team player, right? So these things are very important now. And yeah, that happens. Secondly, they're going to ask you about hobbies, how you are as a person, whether your hobbies align with people in the program. Let's say I'm into meditation. Is the
Mm.
program about meditation? Are they looking into integrative medicine, where they're looking at into mind-body relationship and stuff? Are they excited about that? um, let's say I like psychotherapy. Is the program into psychotherapy? Because a lot of programs are not into psychotherapy. They're like psychopharmacology, and they are totally away from psychotherapy, right? Some programs are psychotherapy heavy. So they're looking for that. Like match is all about that connection, whether
Right.
you like as an applicant, your personality and your aspirations match with the program. That's what's important, right? Like it's also called as the fit, whether you are
Mm.
going to fit in the program, right? That's it. Like it
Right.
doesn't matter if you're a star applicant, like I told you.
Mm.
What matters is like, are you the star applicant for that certain specialty
For
and
them.
that certain program?
Right.
Like I had two pre-matches rejected. Like so, this is this thing called the pre-match. So
Okay.
what a pre-match is whenever you're going through the match season, right? Match results are announced when March 14th, and then you get to know like where you match on March 18th. But
Right.
certain programs give out pre-matches where, let's say, they interviewed you like in the match season, and about a week after you'll get the contract letter. They're like, we are interested in you, just withdraw from the match and come with us, right? That's
Oh.
called a pre-match. I interviewed with two programs that were pre-match programs, did not get a pre-match from any of them. And I was disheartened because I was like, why, like, does that mean I'm not good enough? Like, but I was
What
not
went
good enough
wrong?
for them.
Mm-hmm.
Yeah,
Right.
yeah. The thing that I did not understand at that time is I was not good enough just for them,
Mm-hmm.
right? They
Right.
were not my top priorities, but I was like, I should have gotten that pre-match, at least they should have offered me something. Did not offer me anything. But again, they were community-based programs, like community and so I was more of a university-oriented person, and I did not realize that in the interview. And later I realized that, like, okay, my aspirations are more university-based, research-oriented, and that's why, like, I did not get those pre-matches because I
Right.
was again not a good fit.
Right. That's a brilliant insight. I didn't know about this whole difference between a university-based approach and a community-based applicant. So that is definitely something that everyone needs to think about and see where they fit in and understand what direction you fit in and and that your hobbies line up with your aspirations.
Yeah, and the thing is, they care about it. They care about your
Right.
aspirations because they want you to thrive and they want you to
Right.
shine. And if you're not happy in that program, like,
Then they are
what
not
good
happy.
would that? They're not going to be
Yeah.
happy because they're
Yeah.
like, okay, we can't help him or her. And then, like, if they can't help you, you're not going to help them, like, properly, right? So it's not going to be symbiotic.
Right.
So,
Right.
yeah.
Absolutely. Okay, so our next question is now we have some miscellaneous questions. Someone has asked us if my program sponsors a J1 visa, is it hard to get a work visa?
No, like, so J1 itself is the work visa, and like, it's not hard. Like, J1 is like, the steps, the whole process is long, a lot of steps, numerous steps, and it does take time. It's hard, like, if you want to put it that way, takes 2 months. But yeah, it does take time, but it's not hard considering you've gone through the USMLE process. If you've been through the
Right.
USMLE process, you're gonna be like, you have to go through this, right? So yeah, don't worry about it.
Right. All right. So our next question is, can Indians register now and get ECFMG certificate after the 2024 rule change? Since ECFMG is now, they've introduced a new rule. So is it possible to get it, register now and then get the certification later?
So what that means is, like, a lot of people misinterpret that anybody who joins medical school in India on or after 2024 would be unable to apply for ECFMG registration, really, and would be unable to write the steps because of the new WFME accreditation policy. But if you're in medical school right now, right, and you've joined before 2024, you can apply, like, in any year for ECFMG
Okay.
registration, and then you can write the steps. So there's no
Okay.
issue.
So even if you've joined before 2024, you can even register for ECFMG after 2024, as long as you've joined your medical college before. Is that what you're saying?
Yeah, but, like, no. So what I'm saying is you have to do it before 2024, right? Even if you're in first year, you can do it. Even second year, you can do it. Third year, fourth year, it doesn't matter. But before 2024, if you're in a medical school, like, even let's say 2023, just apply
Mm-hmm.
for ECFMG registration. You can
Okay.
even write your steps after 2024. That's fine. But the registration is the most important part. Does that make
Okay.
sense?
Right, right. It makes sense. So you register
So
before 2024 and you're safe.
yeah, you're safe. Like, and doesn't matter which like, which year you are in. Like, if you just apply for ECFMG registration right before 2024, you can write the steps anytime. Don't worry.
Right. Perfect. Understood. All right. So our next question is, what are some things you would change in your journey if you got a do-over?
So the first thing I would change in my journey would be I would like do specialty specific activities, volunteer activities specifically from the get go. For example, take part in like, suicide prevention, like volunteer groups. There are volunteer groups for that, and then there's mental health volunteer activities that you can take part in. You just have to search. Like, I would do that because that would make my application more coherent and would show interest earlier on. So that's important. Secondly, what I would do is network. So there are these things. So like, you know about Twitter,
Right.
right? So get on Twitter, write hashtag Twitter, and start like, you know, scrolling every day and see the posts by people, by PDs, and I would start following them. You know, like look at Twitter, and then there are other things like, let's say I want to go to psych. There's hashtag psych Twitter. So PDs, residents in the US, they post with hashtag psych Twitter, and I would start following them, start interacting with their posts, messaging them if I can, and you know, again, like asking them for mentoring opportunities if they have the time. Networking is critical in this whole USMLE game, and people from MAMC and AMSD, they already do it from the start. So that's something. So get on Twitter, a very good platform. I would also go to Residency Explorer and Frida. I would look up people like residencies first, IMG friendly residencies, and then I would look up the PDs and the associate PDs and start following them on Twitter and LinkedIn. And just like, you know, what happens is you never know if an opportunity comes out of that. Like, let's say
Right.
they're looking for somebody in a country, like they want to conduct a research. You might be that somebody. They might be looking for some volunteer activity that they can do with your college, and that like you can be the person who is the you know, the mediator of that. So I would do that. Just get on Twitter and LinkedIn. Great platforms for professional, you know, if you want to connect professionally. Thirdly, what else would I do? Uh, I would start preparing for USMLE from the first year of medical school. I know that's very contrary to what other people say, but the earlier you start, the more you're going to connect whatever you're reading in the basic sciences to your USMLE preparation. And that's going to make the whole process far easier for you, because you're going to start connecting the dots from your first year, which is going to stay for longer. Because of that, like your knowledge is going to stay for longer. Does that make
Right.
sense?
That makes sense. That makes a lot of sense. And I'm feeling that I've begun my preparation now in my third year, towards the end of my third year, and I'm really feeling that. But I wish I had begun much, much earlier.
Yeah, because then you know, okay, you're reading biochem, and you're like, okay,
Yeah.
this part of biochem is really important for the USMLE process. And you're gonna learn that better. You're gonna like, and you will have more time to explore that, right?
Right.
Like
Absolutely.
later on, you're like, okay, why am I reading this biochem pathway? Why am I reading about gluconeogenesis, right?
Right. Absolutely. So there's someone asking here, how do you begin a conversation with PDs or mentors on social media? What can you begin talking about?
So I would not begin what I could write is like what a lot of people write is, hey hashtag met Twitter, or hey hashtag site Twitter, as an applicant for the match 2024, what are some of the things I could do to improve my CV, and see who interacts with that. And I could start posting about those things. Let's say I do a poster presentation. I could post about that on Twitter and LinkedIn on like hashtag met Twitter, hashtag site Twitter. If you're applying for pathology, hashtag path Twitter. So there's just like these hashtags that you can
Right.
use. I would not like go and specifically approach PDs right now. I would just see like if they are interacting with my posts, and I would try to interact with their posts first. So let's say a PD posts about something, I would comment on that, like, you know, try to encourage them, like, thank you for your advice, or and I would retweet it, right?
Right.
If I feel the PD like knows about me, and they're like seeing that I'm interacting with their posts, I'll just send them a DM that you know, thank you for posting such great content, and I'm a big fan. Please let me know if I can help in any way. Like that. I would not ask for something. I would be like, okay, lead with a giving hand. Okay. So
Right.
if you need anything, I'm here. Okay. And they're like, okay, this guy loves me. He's my follower, and you know, they'll remember you. So just think about it. Like, let's say you're following them for about 2 to 3 years, and then one day you're gonna apply. They're gonna see your application. They're gonna be like, I know this person,
Right.
right? Think about that. And I would also start posting about, let's say I love psych, right? I'm going to post
Hmm.
about like what's happening in psych on psych Twitter, and the PDs might start following me, and they're like, oh, he's interested in psych from such an early age. So that's something too, right? You can show your interest through these platforms too. Just like give them a connection request on LinkedIn, and like just follow them on Twitter and interact with their posts. They might start following you too. Also on Instagram, what you can do is you can start following residencies. So let's say you want to follow Sunny Downstate, just type Sunny Downstate on Instagram, and you can see their residency. Just start following them and see what they do every single day, like what's special about Sunny Downstate. And if you ever get in an interview, you can talk about, okay, you've been following them for about 3 years. You like this, you don't like, right? Does that make sense?
Right.
Because they're going to be like,
That,
this guy's interested. Yeah.
yeah, right. That makes a lot of sense. Yeah. And I know we've been talking for a long time. If you don't mind, we'll just go on for another 10 minutes. There's so many questions here.
Sure.
Right. So, what is something that you've learned along the way that you hadn't read about earlier, or you didn't know when you started out, but you do know now, which you think all of us here preparing should know?
So I think like USMLE itself is like, it's not a marathon. It's rather like I learned it from somebody, like it's not a marathon, it's rather a series of sprints. And I think it's very important to take rest between those sprints. And you can't just go like step one, step two, step, like, in that. And you have to, like, after each sprint, you have to take rest and relax. And you don't need to worry about the whole journey at one point, because that's going to scare you, right? It scared
Right.
me. Because let's say, like, I'm somebody who wants to go to the US for residency. And now I'm going to just, like, somebody tells me, okay, you have to write step one, that's like 8 hours long. You have to write step two CK, which is 9 hours long. Then you have to write step three, which is 16 hours long. Then you have to go through the interview trail, which is 6 months long, right? You have to rank programs. You have to go to electives. And you, like, so many people are going to chicken out when they listen to that, and they're just going to run away. So take it one step
Absolutely.
at a time and run each sprint. But take your rest after each sprint, right? And don't worry about the whole process at once, because it's going to scare you, right? It certainly did that for me. Because if you had told me like 2 years back that the interview process was 6 months long and it's just like so hard, right? I would have given up that time. So, but I wouldn't say that. So just one step at a time, and focus on, like, don't worry about what's going to happen further, right? Just do that one step and focus on that one step. When you're writing step one, don't worry about step two CK at that time, or what's going to happen in the interviews. That's a story that you can write later. So just focus on the now, and don't worry about the journey later. Yes, it's good to plan, but again, don't worry about the journey later. Just focus on, like, just run the sprint you're running right now.
I think that's great advice, because the whole process together, it looks really daunting. I know I'm very scared, but yeah, taking it one step at a time would definitely make it easier.
Yeah, like, I think
Right,
that's something.
right. So another question, and a lot of people are asking this, for those who want to take internal medicine as their residency, beyond that, in their fellowship, you're going to have to select a sub branch like nephrology or cardiology or whatever it is. So, does that is that decision supposed to influence the elective you take? Is that something that you should decide now?
I don't think I would worry about it. Like, just do, like, if I were to do an internal medicine elective, I would just try to do an internal medicine elective in like, an internal medicine elective, not in a certain like specialty like nephrology or and all. Because, like, what they care about is you, like, just think about it, right? uh, what they care about is you just know about internal medicine, that's it, like general
Right.
internal medicine. So as a student, or as an extern, or as an observer, I would prefer to do an internal medicine elective, which is like the general internal medicine elective, over
Mm-hmm.
a subspecial, like super specialty, if that makes sense, right?
Right.
So, but if you don't have a choice, you have to go for some, like, just go for whichever you think you might do in the future, but you can always change. Don't worry about it now. You can always change,
Okay.
right?
Right.
I
So
wouldn't
yes,
worry about that.
that was the next question, that you may think you want something now, and later in the future when you actually go through a lot more experience in that field, if you decide to change your subspecialty, but your previous experience is all about something else, then is that a problem? Because like we were talking about psychiatry, and at this step of USMLE, they want to know how, like we were saying, your interest needs to be consistent and coherent. So does the same apply for someone choosing a subspecialty later on?
Yeah, like it does for psychiatry. Like, uh, that, like, I would say not for a subspecialty. For example, like for psychiatry, that would be child and adolescent psychiatry or addiction psychiatry, right? but my interest is in general psychiatry as a student, right? So
Okay.
that's how I'm putting it. I never said like I want to go into child and adolescent, and I'm showing that interest from the start, right? But if you can, that's good. If you can, that's
Okay.
great, right? But not everybody has that.
Right. So if you don't know, then just it's better to pick internal medicine in general at the moment and
What I
choose
would
your
do is, let's
specialty
say
later.
there are multiple subspecialties in psych. I would do just like one in child and adolescent, one in addiction, right? Show interest in general psychiatry as a person and
Okay.
see where that takes me in residency. Because right now, I think it's just way too early to think about a super specialty. Like, it's okay to think about a specialty, but like thinking about a super specialty, if you're really interested in something like that, do that. But I don't think most people are at that level
Right.
of commitment to a super specialty, because I am not at that level. Like I like a few super specialties, but again, like I wouldn't do
You
like,
don't know for
let's say I'm
sure.
going to, yeah. So I don't know that for sure, but it's up to people. Like, let's say somebody wants to do gastro, they can start from first year. Like, it's up to them.
Right. Okay. So it's okay to take a general internal medicine elective. I think that's fine. That's
Like,
probably
yeah,
even the
that's
right way to
specialty
go.
versus specialty. Yeah, that's specialty
Hmm.
versus specialty. What people are talking is super specialty versus super specialty. Like, that's another
Right.
level. Like, right? Does that make sense? I was never about child and adolescent versus addiction versus forensic, right? From the start,
Right.
right? It was never about that. I was always thinking about this, like, right, because in the match right now, you're not going in a fellowship match. So don't
Hmm.
think about that, right? You're going towards a general specialty match. So don't worry about these things at the moment. But yeah, that's a
Okay.
good point to think about. If you can do that, do that. Like, I don't think most people are at that point at the moment.
Right.
Even American grads, they're not at that point. So don't worry.
Right. No,
Yeah.
that's very understandable, I think. Right. So, then we have a couple more questions.
Yeah.
Is it too late if someone is somewhere in the middle of their internship year and wants to begin the entire process from scratch now, but with full dedication? Is it too late to start?
It's never too late is the answer. Like, there are people who do this in post graduation or after post graduation. So my answer would be it's never too late. Yes, you might be a bit behind, but it's up to you to catch up, right? There are people who catch up. You do need to do a bit of an extra, like, the extra work to take, like, to rebuild your knowledge of preclinical subjects. Yes, it's gonna take time, but again, so many people do it, so it's not late. Don't worry about it.
Right. And on the other end of the spectrum is another question saying, when is the earliest you can take step two? If I start in first year, is it possible to take it in third year?
So step to CK, generally, I would say wait like till the end of your fourth year, because, like, again, it has a lot of clinical subjects, and like at least go through your fourth year and go through your postings to at least have baseline knowledge, so that you can build that, you can use that to build step to CK knowledge on that. So I wouldn't take it in third year, even if it's allowed. I wouldn't take it in third year. It's just way too early.
Right. Another question is, can electives be taken up? Can you apply for an elective without giving step one?
Yeah, there are a lot of electives like that just like require TOEFL as like they just want the English proficiency test and you can go. However, it's going to be very expensive. If you don't have step one, these electives cost like $5,000 or something like that. So very expensive. Mount Sinai has one, I know. A few other programs has, but like if you get step one under your hood, then like electives get much more affordable, and the range of places you can apply to, like, just increases. So I would take step one and then go.
Right. So does the fees of the exact same program differ if you've
No,
taken
no.
your step one or step two? No. It's just about which you can apply to.
It just opens up more options. Like, so for example, Cleveland Clinic requires step one, and without step one, you can't get in. So, and Cleveland Clinic is just like very affordable. I think $400, $500 with housing
Okay.
included. So that's like
Okay.
very affordable.
Right. So Manik, is there a resource or maybe a website or something where you can get the various different like how you said Frida and the other ones for the residency programs, somewhere where you can find out about electives and maybe their requirements and the costs and things like that in one place?
In one place, like there's no certain place like that. So there's a blog by Dr. Sebas. I can send it to you. Like he's written down a few places, so you can go over it. But again, a lot of these places will require for your school to get into the BSLO network. So
Okay.
I'll first share the post with you, to share it with people and let them go over it, and
Right.
just get your school into the BSLO network. And then you can like apply for certain institutions. A few other places where you can like ask these questions would be like, first of all, I would go to Reddit. So Reddit has a few forums. There's this thing called the IMG Reddit. You can go
Right.
there and you can post questions. So that's very helpful. There's R step one and R step two if you have any step one, step two related doubts. There's also Residency Match 2022 where you can, like, let's say you're going through the match. So they have like R Residency Match 2023 for the next year. So they're very helpful forms where you can post and
Okay.
other people can help you and you can get peer-to-peer mentoring. I would also
Right.
follow Inside the Match. So Inside the Match is like a page on Instagram. You can just like search this up on Instagram. It's run by residents from University of Washington, and they post opportunities for research, and they post opportunities for any electives on their page,
Wow.
right, that open up. So inside, it's called Inside the Match. They're also on Twitter and they're very helpful. Project IMG is also helpful. So they post about these things and it's a free resource that you guys can use.
Right.
But yeah, I'll make a list of these things and just share it with you, like that IMGs
Yeah.
can use, and it's just gonna help you with everything. So,
That'll be very helpful. Yeah. So another question is, how easy or difficult is it to get a B1 visa to go for your electives?
so B1 like visa isn't that hard. Like all you need is like, for example, the way I got a B1 visa is I showed, like I applied for a conference in America and I got the letter of that invitation and I showed it to the embassy and they just gave it to me. So that's how it
Cool.
worked out for me. So if you can show that you're going there for a purpose and present them, like, just join AMA, American Medical Association, they have conferences, join certain organizations. It's not that hard to get. And if you're a student, it's especially easier because they know that you have to complete your degree to make a living and you have to come back, right? You're not going to lose your
Right.
degree in the middle. So it's going to be easier if you are a student. So yeah, I would try to get a letter from someplace in the US like that is inviting you for a certain conference and just show it to the embassy letter. And it's not that hard. Again,
Right.
Project IMG has a post on it on how to get a B1, B2 visa. Another person called the what is her name? The IMG journey. I'll share her page also. She's made a post about how she got an emergency B1, B2 visa,
Okay.
like just recently. So if anybody is like, they have questions, they can DM her. I think
Okay,
she's
that's
pretty
great.
friendly.
Okay, that's great. The next thing is, how long does it take for Indian students to get citizenship in USA?
So if you're an if you're an Indian, there's a long line of people. Just know that. So even if, let's say, first of all, like what matters is which visa did you get for your residency. So residencies either give you a J1 or H1B. For H1B, you need step three. But and like even if you have step three, what happens is a lot of residencies don't sponsor H1B, which is like an issue. So let's say you go on a J1. So the problem with a J1 visa like which is an exchange visitor visa, is you can in no way apply for green card, right? Until you end your J1 and translate into H1B. So J1 is just an exchange visa. Even if you get married to a US citizen while you're on the J1 visa, you can't get the green card like till you end your J1 period and your waiver.
Right.
So after J1, you also have to do a 2-year waiver where you either have to come back to the home country, right, and work here, or you have to find a waiver job there for 2 years in an underserved area. You have to like work for 2 years and then you can translate into like the H1B visa, right? Once you translate into H1B visa, then you can apply for green card. So let's say you apply for H1B. There are two pathways. One is EB1, the other is EB2, right? EB1 stands for extraordinary category. So if you have research under your belt, you publish a lot of papers, it takes a lot of time. Let's say a lot of papers, you can apply and you fit the category of EB1, you can get like green card within about like I think 1 year, 6 months, 1 year, very fast. But it's
Okay.
very hard. It's very hard. It's easy to say. It's extremely hard to get. EB2 is much easier. It just requires a few less papers, and the hospital can file it for you. But it takes about like I think for Indians it takes 10 years. So if you're an Indian, assume 10 to 15 years, like for an average case. Like for most people, 10 to 15 years. If you're not Indian, let's say you're from Nepal or like, or if you're not Chinese, right? India, China, all these places have too many people who are applying for green card. So the green card line is very long. So you don't get that. So 10 to 15 years for India, China. The rest of the countries, it's faster, like 4 to 5 years.
All right. We'll take one last question. I know I've taken a lot of your time.
Don't worry. Yeah.
So there are a few people asking about what is the pathway to get in for a competitive fellowship like cardiology if you've done your residency of internal medicine in India.
So like I can't comment on this because I have no idea, but you do have to do USMLE steps is what, like I can't comment on this because I don't know everything about this. So that's something. But what I do know about this is you need your steps. So you need to go through the USMLE step 1, step 2 CK. I'll get back to you like on this later because I have to yet find a person who's done this. They have done like their home country residency and then applied to the US for fellowship. So I'll get back to you on this, but one requirement is the steps. You cannot bypass the steps.
Right.
Even like if you've done your residency here and you want to apply for fellowship there.
Okay, excellent. I'm not going to. I think we'll stop with the questions now. If you have any more questions, guys, please DM us. We'll try and answer as many questions as possible. But Manik, thank you so much for coming live with us today. This has been such an excellent session.
Thank you so much. So by the way, like Dr. Ishit Chauhan, like you can see him in the messages. So he he did his prelim here in general surgery in the US. So he just commented. So you take the steps and then apply for the fellowships directly. However, you cannot practice like as a fellow in the US.
Okay.
So you can so what he means is you can apply in this thing called the fellowship match. So what happens is, so let's say you get into internal medicine, right? Even in the US. For the fellowship, you have to apply for this thing called the fellowship match.
Okay.
So there's another match that's going to happen. You can never escape the match, right?
Right.
So if you've done your home country residency, right, and you want to apply for a cardiology fellowship in the US, you have to participate in the match, which is going to require the scores, right? So that's important. But in the end, you cannot practice in that country.
Okay.
Like in the US.
Okay, so you can complete a fellowship. Right, okay. So train there and then come back and practice in your own country.
Okay.
Okay, got it. Thank you so much. And this session has been so insightful. There's been so much information. Thank you for being so generous with the information that you've shared with us. I think everyone learned a lot. We've had a consistently high viewership right through. So thank you so much, Manik.
Okay. Yeah, thank you so much. And another comment that's very interesting is there are people who are like have done their home country residency and then they do fellowship in the US and then they redo their residency in the US.
Okay.
And then they can practice as cardiologists. Does that make sense? So it's like a backward thing. So you do your fellowship, then you do IM again. So does that make sense?
Right. Okay, it makes sense. So you can do that as well. So you can do a fellowship and then come back to do your residency, and that order, that sequence is okay.
Yeah, I think so. Like I know one person in Stony Brook who's done that, because even I was surprised. Like he did his fellowship like in Stony Brook medicine in cardiology, and then he was redoing his residency in Stony Brook, which was like, and I was like, what's happening there? I think like his comment like answered that. So you can probably do that. So I'll get back to you on this though. Like, and I think that's possible.
Right. Okay, that's very interesting. I'd definitely read up more on that as well. But yeah, excellent.
Okay, thank you so much for having me. The pleasure was all mine. I enjoyed this session, and let's have more sessions in the future. Let
Absolutely,
me
we
know
would
once
love
you get
that.
into the US.
Yeah,
And guys, if you have any questions, you can DM us. I also have like a group called the USMLE Verse, which is like you just go to my profile, and the first highlight I have is this link to a Discord channel. If you have any doubts, there is peer-to-peer mentoring. If I get free, I answer there, like any free time. So just ask your questions there. So you can get free guidance. And thank you for having me. And
thank you so
I
much for
hope
being
I'll
here.
see you.
Yeah,
Yeah, like I had a lot of fun. Yeah, take care.
yeah, this was great, and all the best for your whole preparation for residency and residency ahead. Hope you have a lot of
Sure,
fun.
thank you. Okay, take care.
Yeah, bye bye.